I would just like to begin this tutorial by stating that any discussions about mental health and suicide have been carried out with care and sensitivity, especially surrounding those with a lived experience of mental ill health and suicide. This extends to those who care or who have cared for those with such issues. So what is meant by the term mental health? A state of mental well-being enables people to cope with the stresses of life, realise their abilities, learn well and work well, and contribute to their community. Indigenous Australians understand mental health and physical well-being as an expression of the relationship that exists between land, body, mind and spirit. Cultural, physical, mental and spiritual health stems from a relationship between the land and its people, and it's the interrelationship between these factors that make up overall well-being. Indigenous Australians' concept of good mental health consists of a sense of belonging, having positive relationships, strong cultural identity, and having purpose and value. The social emotional well-being includes 7 interconnected domains: mind and emotions, body, family and kinship, community, culture, country, and spirituality and ancestors. It's been said that crucially it must be understood that when the harmony of these interrelations is disrupted, Aboriginal ill health will persist. So strengthening the connections that exist between these 7 domains of social and emotional well-being has been shown to positively affect the overall health of Indigenous Australians. The World Health Organization defines mental health in the following way. At any one time, a diverse set of individual, family, community and structural factors may combine to protect or undermine mental health. Although most people are resilient, people who are exposed to adverse circumstances, which include poverty, violence, disability or inequality, are at a higher risk of developing a mental health condition. So with that in mind, the high prevalence of mental illness and suicide among Aboriginal and Torres Strait Islander people reflects a significant impact of colonisation, the transmission of trauma across generations, and the loss of connection to country. Understand the socio-historical cultural factors that have shaped the lives of Indigenous Australians is essential for effective mental health treatments and suicide prevention initiatives. So what is happening across Australia? In 2018 to 2019, over a third of Indigenous Australians reported having a current mental health condition. The proportion is higher among females than males, and almost a quarter of all Indigenous Australians reported having a current long-term mental health or behavioural condition. So more than 1 in 10 individuals reported having a long-term diagnosed anxiety or depression. Suicide is now a leading cause of death for Indigenous Australians who experience a much higher rate of suicide than that of non-Indigenous Australians. In 2022, the rate of suicide deaths is approximately 2.5 times higher among First Nations people compared with non-Indigenous Australians. And living in remote areas is associated with higher rates of suicide among Indigenous Australians. In 2022, Indigenous males and females experience suicide rates at a higher rate than their non-Indigenous Australians. For males, it's 2.6 times higher for Indigenous males, and for females, it's 2.5 times higher for Indigenous females than non-Indigenous. Outcome 14 of the National Agreement on Closing the Gap has a target of significant and sustained reduction in suicide of Aboriginal and Torres Strait Islander people towards zero. But the status in 2022, well, there were around 210 deaths by suicide among First Nations people. And in the 4 years from 2018 to 2022, the rate of suicide among First Nations males was higher than First Nations females in all age groups. Clearly, this outcome is not being met. Indigenous Australians are not accessing mental health and suicide prevention services. So what is being done to help? Well, there's the formation of the National Aboriginal Community Controlled Health Organisation, which is a leadership body for Indigenous health in Australia. They have a program that is aimed at helping Indigenous Australians called Culture Care Connect. And this is the flagship program of the NACCHO. It is deeply centred on people. It wraps around an individual through connection to culture and community. The program combines suicide prevention and holistic aftercare. Culture is the heartbeat of the program, and it provides care, support and services to Aboriginal and Torres Strait Islander people. It's centred on self-determination and community-led action. The services are delivered for community, with community and by community, and it means that each program site is unique to the priorities and needs of their community. The National Aboriginal Community Controlled Health Organisations can be found across Australia, from urban, rural and remote regions, and it focuses on preventative care and health education delivered by Aboriginal health workers and nurses. Culture Care Connect's motto is cultivating culture, care and connection for meaningful support for communities. It operates out of 30 Aboriginal community-controlled health organisations, and it employs 100 people from their local communities to support local suicide prevention activities. It's a community-run primary healthcare service for Aboriginal and Torres Strait Islander people. These services address physical health, but also the social, emotional and cultural well-being of individuals, families and communities. Culture Care Connect exists to raise awareness, provide early intervention and crisis management as well as aftercare services. These aftercare services are support for the person who has attempted suicide or who's thinking about it. They also have postvention services, which is an immediate response after a suicide death, and it provides ongoing support for family and community. The CCC program employs people from within their local community, and it empowers its people through choice and control of suicide prevention plans and local aftercare. The program centres on self-determination and is delivered in a culturally safe environment. By placing Aboriginal and Torres Strait Islander communities at the centre of healthcare delivery, they play a crucial role in addressing inequalities and improving health outcomes for First Nations people. The program offers many resources through the Aboriginal Community Controlled Health Organisation Centre and can be accessed online. CCC provides many resources to raise awareness and promote early intervention. These can include Stay Proper Deadly Online, Yarn Space, a Stronger Together campaign, Smiling Mind app, Stay Strong, Look After Your Mob, and so many more. Culture Care Connect aims to improve Aboriginal and Torres Strait Islander mental health and suicide prevention outcomes. They want to build understanding through working with Aboriginal and Torres Strait Islander experts and those with lived experience, to provide a culturally appropriate mental health system workforce, provide early intervention measures that contribute to improved social and emotional wellbeing outcomes. The success of the program lies in its 26 network sites and 27 aftercare sites across Australia. They've also seen an increase in the engagement from mainstream services like the police and hospitals and other local services. The aftercare services have seen a greater engagement by community members when they're in crisis. And it also focuses on providing support for the person who has attempted suicide or who may be thinking about it. The strengths of Culture Care Connect is that it has connection to culture, country and spirituality. Without cultural connection, Indigenous Australians are separated from their protection and support of their culture, community and country, which provide for their health and well-being. It enables the self-determination for Indigenous communities in relation to their own cultural and community well-being. Multiple resources are available for support and connection and education. It provides Indigenous Australians with improved access to services and continuity of care within holistic mental health and suicide prevention models. It uses cultural knowledge and principles in culturally responsive and trauma-informed healing. And it promotes personal and community empowerment for Indigenous Australians and a continuous quality improvement of the program. But what doesn't work? Indigenous Australians are not accessing mental health and suicide prevention services at a comparable rate to non-Indigenous Australians. So the limitations are, there is a bigger need for skilled Indigenous workers in the communities. There needs to be greater physical access to centres. Wi-Fi service in remote regions is poor, and this is the area of greatest need, so services can't rely on computers and phones alone. There also needs to be an increased awareness of the Culture Care Connect program through greater education of what is available. The barriers to Indigenous Australians accessing mental health services may be that services are inaccessible for financial or geographical reasons, or there may be a reluctance to use these services because they're not perceived as culturally safe environments.